Hi, my name is Bienvenu. Again, we're going to do NG tubes for medications. Um, Also, this relates exactly to PEG tubes as well. So all the steps we do today is going to be exactly the same. It's just different locations. One's going to the nose and the stomach. One has a direct port straight to the stomach. Just going to clear that up before we get really started. Of course, check your physician's order, compare it to the MAR, make sure it's the right patient, right route, right dose. Make sure all your first checks is going to start right there at the desk. You get your orders compared to the MAR. Gather all your supplies. We're going to have a 60 milliliter syringe, which you're going to hook up directly to the NG tube. We're going to have water to flush. We're going to have a cup and have your pills or your medication, a towel to cover yourself, stethoscope, which is to verify placement. Huge right here. Medications, we got to make sure that they're all crushable. No enteric coated, no extended releases, none of those things that are contraindicated to crush. So we got to make sure that we are aware of that and make sure that, because you don't want to give a medication where it's just a rapid dose of it right now, which wouldn't be good for the patient. We need to make sure just however it's prescribed, we need to maintain that same consistency. So I'm in my med room. I have my MAR, have my medicine. Everything is crushable. Everything's fine. So I put it inside the pills inside a bag, crush it all up, and it becomes powder. Get it really, really fine. Now we're gonna put it in the cup. This next step is really huge, really important. I see a lot of errors when I see this. Sometimes students, nurses, whoever, they fill the cup up with so much water they would have to dilute it, where you push in almost 200 milliliters into the stomach, which is not good. You want to use the minimum required amount to dissolve the pills or the medication so the patient can absorb it. Now your next step is you're going to go into your patient's room. You're going to do your medication administration checks. The right patient, right dose, right route. All these things again a second time or a third time. You can never have enough checks to make sure that this is for that patient. So everything is fine now. We've checked everything. These medications can go through this route. We have the right dose. All the safety has been covered now. So now I'm gonna walk in. Did those checks. Hand hygiene. I mean, you're gonna be dealing with medications. Wash your hands. Identify your patients again. Now you're going to put your patient in high filers to prevent aspiration. Drape the towel over the patient, make sure it's clean. You're going to put your gloves. Sorry, here. Have your gloves on. It's a clean procedure. You it doesn't have to dress out sterile, but you want to make sure that you are, of course, clean procedure. So have your gloves on. Your next deal is verifying the placement of the tube. Make sure it's in the patient's stomach. So you have your syringe. You want to aspirate. Right? Aspiration is really important. In videos in the past I've talked about, and I'm going to reiterate that 3 or 4 times per policy. Aspirate. Make sure the gastric content is emptying out, or in this case, absorption rate is good. So you need your stethoscope. You can hook up directly to your patient, introduce yourself, tell them what's going on. You hook directly up into here, and you aspirate. Aspiration means basically you just pull back as much contents as you can. Okay, so whether it be 5 milliliters or 100 milliliters or more, you're going to push it back in because that is the patient's contents, his nutrition or her nutrition. We are then going to go and flush it. So I have my medication, everything's dissolved. I'm going to suck up the fluid out of the cup. For this video purpose, I'm going to use this here. My medication is dissolved. I'm going to suck up. Ideally, try to stay around roughly say 40 to 60 milliliters, which is more anywhere from say 40 to 60. Ideally, I try to keep it in one syringe just because you don't want to push that unnecessary amount in. So I have my medication, lines flush, clip it here, and so you can see in. Obviously take this off, clip in, and we're going to push the medications in. Just slow and steady and consistent. Right. So everything is pushed in, and clamp it back off, or connect it back to the tube feeding, or suck it, into the feeding, back into it, and follow behind the medications. You want to flush the line. Make sure when flushing we're some 15 to 30 milliliters of tap water to make sure that the medication actually gets to the stomach. Apologize about that. Emails are coming over. So you don't want the medication, if you didn't flush the medication, just sitting in this line, defeating the purpose. Now, let's see, not 15 to 30. You're going to flush with 50 to 60 milliliters of fluid after the medications. Sorry about that. So everything's clipped back up. And another important thing is make sure, anytime you're doing this, make sure that your patient is in high files again, or sitting up at least 30 minutes, and make sure that the suction is left off also for at least 30 minutes, because it's defeating purpose if the pump is sucking it back out. Chart your medications that you administer at a certain time. Make sure that the tube placement was in the correct position. The amount of volume you use to flush, dissolve the medications, all that should be documented, and it factors into the I&O for the patient throughout the day. And as well, document any response the patient may have had throughout the process. And I believe that is it, and thank you.